All right. Good evening and welcome to another session of embryology lecture. We are looking at the endocrine system today, and it's one of the low content type of lecture, which means that we are going to finish in less than the usual hours we spend on other lectures. Okay. And then after the lecture, there's a discussion I would want to have with you beyond the lecture today, if there is time and you have the strength. I'm sure because this is a special arrangement, you may be tired out of today's activities already. So if we finish and you think you are tired, we can decide on when to have that discussion, but it will not be that long. Okay. So without wasting much time, let's look at the structures we'll be covering. We are looking at the pituitary gland, which is located around this portion. Let me activate my cursor, my pointer, so that then the pineal gland, parathyroid, which is around the cervical region, adrenal gland, which is also known as the suprarenal because it is on top of the renal organ, the kidney, which is divided into a cortex and a medulla. Then the thyroid gland, which has follicles, parafollicular cells, and then secrete enteroendocrine cells as well. All right, so we will look at these in details. So if you look at the pituitary gland, which is located there, it is also described as a master gland because it has control over many of the endocrine glands. So the anterior pituitary secretes adrenocorticotropic hormone, follicle-stimulating hormone, growth hormone, luteinizing hormone, melanocyte-stimulating hormone, prolactin, thyroid-stimulating hormone. So you can see that it's even regulating or influencing the function of the thyroid gland. That's why we call it a master gland. The pituitary has the anterior side and then the posterior. The anterior side is what I've mentioned, the functions so far. The posterior pituitary deals with antidiuretic hormone production and then oxytocin. The adrenal glands, I've already said, has the cortex and medulla. The cortex secretes the corticosteroids. The medulla secretes epinephrine and norepinephrine. Then we come to the thyroid gland, calcitonin, and then thyroid hormone. So you first of all take the pituitary. I have looked at your PBS scenario and the objectives, and I'm happy that it covers most of these. So I hope you follow. Ideally, once you cover it in PBL, as we do here in UCC Medical School, we don't do didactic lectures. We allow the students to brainstorm and then develop their own understanding. So it means that this is a bonus. So you need to really get the understanding better. Okay. So the pituitary gland appears in the 3rd week and originates from 2 portions. One is the oral ectoderm and the other is the neuroectoderm. So we are using the blue and red colors to signify it. So the red is the oral ectoderm or the oropharynx. Okay, and you see that it forms something like a pouch. If you remember when we did the pharyngeal arches and pouches, okay, we had the pouch and the cleft. So it is pouching. It means it's moving outward. That is the Rathke's pouch, which is named after Rathke, who was the one that discovered that. Okay, So eventually the blue and the red get closely attached. Okay. So this red portion is passing through the foramina created in the bone called the sphenoid bone. So eventually, once they are attached and become good friends, they embrace each other and decide to stay together in one room known as the pituitary fossa. Okay. So because of their position in relation to anatomical position, one will become anterior and the other becomes posterior. Okay. So the one that faces the frontal part of the body, the face, is the anterior lobe. And then the one that is behind is the posterior lobe. Sometimes we say anterior pituitary and posterior pituitary because of this developmental, origin and then location. So if it is mature, this is how it will be sitting in the pituitary fossa of the sphenoid bone. And when you take an X-ray of the head, it's going to show you the depression or the fossa where the pituitary gland sits, which is also known as the hypophyseal fossa. Now, a diagram of the pituitary will indicate that it has a connection with the brain superiorly through the hypothalamus. Okay, so you can see that the substance that the hypothalamus is made up of is the same substance that extends to the posterior pituitary. And because the hypothalamus is related to the central nervous system and contains a lot of neurons, and since it shares the same substance or material with the posterior pituitary, we sometimes call it the pars nervosa. Okay, so you can hear the word nervous within it, okay, as in nervous system or neurons. Okay, so that is what is continuous with the hypothalamus through the infundibulum and then the medial eminence. Okay, then the anterior pituitary, which came from the Rathke's pouch, folds around the infundibulum of the posterior pituitary in the form of the pars tuberalis. Okay, then you have the pars distalis and then an intermediate component known as the pars intermedia. And you can see the bone, the sphenoid bone. Okay, and that is the hypophyseal fossa or pituitary fossa. Now, in a sagittal section through the brain, this is how the pituitary will sit. So that would be the anterior pituitary and posterior pituitary, the infundibulum stalk, which we will expect the pars tuberalis to be wrapped around it, and then to the medial eminence, and then hypothalamus. Then that is the thalamus itself. It's hypothalamus because it is below the thalamus. Okay, that is the corpus callosum. So it means that we have actually entered the brain. That is how connected the pituitary is to the brain. So these are again some of the functions of the pituitary gland. In this case, we are looking at anterior pituitary. So thyroid stimulating hormone, TSH, prolactin, which acts on the mammary gland and testis, then corticotropic relating to the adrenal cortex. And then you also have the fact that the anterior pituitary acts on adipose tissue and then helps in growth. Okay, so growth hormone, and it also acts on bones and muscles. Then you also have the follicle stimulating hormone of the testis and ovary. And then you have the pars intermedia, which is the intermediate portion of the anterior pituitary, helping to secrete melanocyte stimulating hormone. So somebody will ask, what will happen if the pituitary malfunctions? So in childhood, if it malfunctions, it's going to cause gigantism. That means that too much growth hormone can be produced, okay, when there's a tumor in the pituitary, okay, as indicated by that. Who was the tallest man at one point, okay, in the world. Then this one too, the tallest living woman at one point. or because of pituitary anomalies. I saw this in your, what do you call it, PBS scenario as well, which means that you might have read about the malfunctioning of pituitary. In the adult, it causes acromegaly. Okay, so too much GH caused by pituitary tumor in the adult. Okay, and that will also present differently in terms of how the person's face will look like. So you can read more on some of the characteristics which will differentiate between acromegaly and then gigantism. Okay. Now, the pituitary secretion can be regulated, okay, by two main pathways. You have the parvicellular pathway or parvicellular system, and then you have the magnocellular system. But we take the parvicellular system first. In this case, you have neurons producing and secreting hormones that will pass through capillaries, okay, known as the hypothalamo-hypophyseal portal vessels. And this will journey into the anterior pituitary gland. Okay, so the parvicellular system is related to the anterior pituitary. And then the magnocellular system is related to the posterior pituitary. And it does its work by the use of neurons. Okay, neurons will produce and secrete hormones directly into the posterior pituitary through its axons. But eventually, they will get distributed into the circulatory system. Okay, so that is the difference. Parvicellular system deals with anterior pituitary. Magnocellular system deals with posterior pituitary. The parvicellular system, which deals with anterior pituitary, secretes its hormones through capillaries, okay, into the anterior pituitary. However, for the magnocellular, it is neurons that produce the hormones directly into the posterior pituitary. It doesn't go through any capillary before it gets to the posterior pituitary, unlike the parvicellular. So once it gets to the posterior pituitary, then later it joins the blood. Okay, so that's the difference. You will see diagrams of this very soon. All right, so these nuclei that you see in the median eminence, okay, or close to the hypothalamus, paraventricular nucleus and supraoptic nuclei are related to the magnocellular system, where we said that the neurons release the hormones directly into the posterior pituitary, as you can see. Okay, so you can see that these ones, the black lines go all the way into the posterior pituitary. So that is an example of the magnocellular system. There is no blood vessel involved. Okay, later they will join the blood. So if you want to use the same explanation, this time the diagram has been shifted about 180 degrees. Okay, so unlike this one where the posterior is positioned here, this one, the posterior is positioned at the right side. So you use these green neurons or color to journey your way into the posterior pituitary, as in the magnocellular system or pathway. So you can see the supraoptic and paraventricular nuclei we saw earlier in the slide before this. Okay. Then you now have the what do you call it? The parvicellular system, okay, which integrates with capillaries, and the capillaries are those that will carry the secretions into the anterior pituitary. So these are the hypothalamo-hypophyseal system or capillaries we were talking about. You can also see that even though the green ones do not give their hormones to the capillaries to send to the posterior pituitary, once they arrive at the posterior pituitary, you now have capillaries that will pick them up. Okay, so that is the difference between the two types of pathways or system. Okay, this is another slide still talking about the same thing. So that's the parvicellular neurons, okay, which will send their substance, the hormones they are secreting into the capillaries, and the capillaries will bring it to the anterior pituitary. In the shadow down here is the magnocellular neurons, which will rather bring this directly into the posterior. Okay, so they travel to the anterior pituitary via the hypothalamic hypophyseal portal system, talking about the pavicellular pathway. Okay. All right, now let's look at the suprarenal gland. The origin is in two ways, okay? Mesoderm and then ectoderm. So that is the origin or source for the suprarenal gland. We are talking of the germinal layer, trigeminal disc, you remember, ectoderm, mesoderm, and endoderm. So the suprarenal gland can be divided into two main portions, a cortex and a medulla. The cortex comes from mesoderm, and then the medulla comes from ectoderm, and to be precise, neural crest. So you have first mesothelial cells and the second mesothelial cells. The first mesothelial cells are primitive, form the primitive cortex, and the second one becomes the definitive cortex. Remember, we did renal not long ago. We also saw structures like pronephros, mesonephros, some coming and then leaving, and then others becoming the definitive kidney, like the metanephros, where the pronephros and mesonephros would degenerate. The full adult structure is achieved at puberty. The medulla stains yellow with chrome cells, so it is known as chromaffin cells. Okay, you do this in histology. So when you look at a vertical section through the embryo, and that's the neural tube, that is neural crest cells, that is sympathetic ganglion of the lateral vertebra, and this is site of developing suprarenal gland. Okay, suprarenal gland will develop around here, and you can see gonad here. Okay, and then you can see mesonephros. We've seen this diagram before. So that is how it is related to the kidney, because we know that once you hear mesonephros, then you are talking of what kidney development. And so it is very close, okay, to where the kidney develops. Now, in the course of development, you have the cortical primordium, starting to develop. Remember, we said here that the cortex comes from mesoderm, medulla comes from neural crest. So the cortex has started developing, and then it is continuing its development. Then at 2 months, you see that the neural crest cells are now invading the central portion of the cortex to become the medulla, okay? To tell you that the medulla is formed from neural crest cells, okay? So that is what you get eventually with the adrenal gland. And histology will tell you that it has 3 main layers: the zona glomerulosa, zona fasciculata, and the zona reticularis, okay, which stain differently. So in the fetus, the cortex is about 20 and 10 times larger than in the adult. Okay, so between 10 to 20 times, let me put it that way, larger in the adult, which means that it decreases as the fetus grows. Okay, so by the time the fetus is growing, it's rather decreasing from its highest limit to what? A lower limit, so 20 to like 10. Okay, the medulla will remain relatively small until after birth. It increases as the fetus grows. So as the cortex, decreases as the fetus grows, the medulla rather increases as the fetus grows. And this is a very notable picture which you remember. Pouch and clefts. Okay, pharyngeal arches, pharyngeal clefts. We've gone through all this before. And you remember this table too. All right, so you can see palatine tonsil. So if you are counting the pouches, this is first pouch, second pouch. So that will be palatine tonsil from second pouch. inferior parathyroid will be from what? Third pouch. And then superior parathyroid is rather coming from fourth pouch. So the question is, why is it that superior is down and the inferior is rather up? It's because the superior is going to move upwards, okay? The inferior will move downwards. So eventually you have the portions which are rather below coming up, okay? So you have the superior parathyroid and then inferior parathyroid to migrate. All right. So when you look at this, you can see the parathyroid here. So first pouch, second pouch is for palatine tons, and then third pouch is for parathyroid. Okay, and then fourth is for the second portion of the parathyroid, which will rather become superior. Okay, and then the third one will rather become inferior. All right. So you can see the arrows showing you how the movement is going. So superior parathyroid gland from fourth pouch, okay, and then the inferior parathyroid from the third pouch. So you can see that the arrow is indicating that the third pouch is moving downwards, okay, to become inferior to the fourth pouch, okay. All right. So that's how the parathyroid develops. If you look at the gross anatomical structure, you see that there are a pair on each side. So in all, you have 4. That is 1, 2, 3, 4. So superior, inferior, superior, inferior. So here you have superior, inferior, superior, inferior. Superior in green, and then inferior in purple. All right. The thyroid gland comes from epithelial proliferation ventral to the floor of the pharynx. Okay, epithelial proliferation ventral to the floor of the pharynx. It is bilobed and it has a middle connection known as the isthmus. You learn this from gross anatomy. So that is the isthmus, and that is the bilobed nature of the thyroid gland. It is connected to the tongue, okay, by the thyroglossal duct, but this will disappear by the 7th week. So this is the tongue, okay, and that is the foramen cecum, which divides the tongue into anterior 2/3 and then posterior 1/3. So that is the thyroglossal duct, which is connecting the thyroid gland. So this is a thyroid gland. So you can see that it's connected by this duct, known as the thyroglossal duct. But this thyroglossal duct is supposed to disappear by the 7th week. That is a potential issue. Okay, I'm sure you will appreciate that. And it's a potential issue that if it is not disappearing, then it's going to cause a continuous connection, and that will not be fine. It means anything you eat and the tongue tries to, roll it backwards, is going to fall into the duct and come into the thyroid gland, but you don't want that to happen. At the end of the 3rd month, it will start producing what we call thyroglobulin, okay, which forms a colloid. Okay, so these are the secretory cells, okay, known as follicular cells, right? So you have the thyroglobulin, and then to be converted into T4 and T3. Biochemistry and physiology will tell you more about that. And you have the parafollicular cells, which will secrete calcitonin. Okay, so follicular cells produce the colloid that serves as a source of thyroxine and triiodothyronine. Parafollicular or C cells is derived from the otomobranchial body, serves as a source of calcitonin. So that's what we are talking about. So we are saying that the parafollicular cells, also known as C cells, come from the otomobranchial body, okay, which serves as a source of calcitonin. The otomobranchial body is somewhere here. So you can see that that's the ultimobranchial body there, okay, which helps the formation of the parafollicular cells of the thyroid. So there are certain congenital anomalies like thyroid agenesis, failure of the formation of the thyroid, lingual thyroid, failure of the thyroid to descend, which means it's linked to the tongue, lingua, aberrant or retrosternal goiter, over descent of the thyroid gland into the thorax. Okay, instead of it staying in the cervical region, it goes into the thorax. It has moved too much. Then thyroglossal cyst, persistence of a part of the thyroglossal duct, which we know is supposed to disappear. And you can also have thyroglossal fistula, which is when a duct opens into the skin, okay, usually around the neck. All right, the pineal gland is not well talked about, okay, but it also plays a very important role. It's situated in the middle of the central nervous system. It develops as a median diverticulum of the caudal part of the roof of the diencephalon. So this is the diencephalon. The diencephalon is the portion where the hypothalamus and the pituitary developed from. Okay, so it's the same region we are looking at where the pituitary. So you can see infundibulum here. Okay, so pineal gland is related. So it is directly opposite here. So it's what a median diverticulum. So you can see that it is diverting, which means that it is moving outward, out pocketing. Okay, and it's directly opposite to that of the hypothalamus and then the infundibulum up there. So this is the way it will come out. Okay, proliferation of cells in it was converts it into a solid cone-shaped gland. Once the diverticulum is formed, you have growth of cells into it, and it makes it solid. Okay, initially it is like a lumen, but eventually it becomes solid. Okay, right. So that would be the pineal gland, pituitary gland in a sagittal session. So, like I told you, it's one of the shortest lectures you can ever have, and therefore you should be able to grasp everything. So that brings us to the end. Any questions or suggestions? So let me go over what we have done today. We first looked at the pituitary development and said it has two origins, and oral ectoderm and the neuroectoderm. And then it develops within the hypophyseal fossa of the sphenoid bone. And then we looked at the two main pathways of secretion, magnocellular and then what? Parvicellular. So the magnocellular secrete is substances through neurons, through its axons directly into the posterior pituitary. It doesn't pass through any blood vessel, but eventually it will give its secretions to the blood. However, the parvicellular system, the neurons secrete, but then gives to the hypophyseal system, hypothalamo-hypophyseal capillaries, before it comes into the anterior pituitary. Okay, you remember that. So that's basically that for you. We also looked at the malfunction of the pituitary, gigantism, and acromegaly. Gigantism in the childhood, and then adulthood is acromegaly. So basically that is that. Then we looked at suprarenal gland and we said it has two main origins, mesoderm and the ectoderm. Ectoderm from neural crest cells. It has two main parts, cortex and medulla. Cortex from mesoderm, the medulla, neural crests. Then we looked at the parathyroid and thyroid. Second pouch, and then the third pouch, and then fourth pouch. And the fourth pouch rather becomes superior parathyroid, and then the third one becomes what? Inferior. We also said that the thyroid gland develops from it forms colloid. thyroglobulin. Okay. And then we said that the parafollicular cells come from the otomobranchial body. So basically, that is what we have done today. Okay. So our time will be running out. I wanted to talk to you about your papers that I marked, the exams you did. I wasn't impressed much about your performance. So I want to urge you to read more, because I give you my notes and also the recording. And most of the questions I asked were basic things that we even did as part of our tutorials. But still, mostly you people didn't get it right for me concerning the tetralogy of Fallon. So kindly sit up for me, okay? My number is with your class rep. If there's anything you want me to explain beyond our normal lectures, you can call me or WhatsApp me, okay? All right. So thank you.
Okay, sir.
Much. And then I'm sure we'll meet again. Feel free to call me if you have any personal issues, okay? All right.
Okay, sir. Thank you very much.
You're welcome. I know you are tired, so I'll leave you to go and rest. I will send you the recording and the notes later, okay? Bye-bye.
Okay, sir. Bye.